My colleagues and I have been working over the last few months on an effort to understand how different communication strategies affect vaccine acceptance. Last year, several members of our team conducted a systematic review to understand how vaccine information online affects vaccine acceptance. The goal was really to assess how communication interventions impacted vaccine knowledge, attitudes, and behaviors. And what our team found, as you might expect, is that this field is quite new and that few studies have asked this question directly. And those that have done so in a very different way in terms of study design, location, intervention, and there's a lot of variation in quality amongst other factors. However, the team was able to draw a few broad conclusions. They found that interventions grounded in behavior change theory, such as risk perception or self-efficacy theories, were more likely to address the underlying vaccine concerns. They also found that salient, actionable messaging and tailored approaches were critical for affecting vaccine behavior. They found that personal narratives, peer approaches such as peer education, were able to affect outcomes through the action of community norms. Vaccine discussions, especially those facilitated by a knowledgeable facilitator, and access to trusted experts can also positively impact these outcomes. And very few studies have examined the impact of these social media interventions in low and middle income countries. So coming out of this systematic review, we wanted to look more closely at how different aspects of health communications impact vaccine attitudes and uptake. So this year we started on an effort to do that through two approaches. The first is to conduct a scoping review of peer-reviewed literature to summarize how variations in aspects of health communications can affect vaccine attitudes and uptake. And the second is to develop messages about COVID-19 vaccination based upon this evidence and conduct an online survey to assess their clarity and appeal for audiences from several different countries. So the primary goal of our scoping review was to describe the existing literature to inform message development and testing through this survey. We defined three primary attributes of vaccination communications, these being the appeal, the approach, and the messenger. The appeal is essentially the core message to attract recipients' interest and attention. The approach is the delivery mechanism by which to convey a specific message. And the messenger, of course, is the person or media that does the conveying of the message. So for the appeals, we found that most of these were health outcome focused, taking an informative approach, but there were also some studies that used the gain-loss frame or adverse events focus. The health outcomes appeals were effective for some populations, such as college students, but not necessarily for others. We found that the gain-loss frame may be more useful among individuals with risky behaviors. In terms of the approaches, there's a lot of evidence that shows mixed results for misinformation correction. In some settings, this can actually reduce intention to vaccinate to backfire, but in other settings, this approach may actually improve attitudes. Storytelling on social media was quite interesting. It seemed to generate high engagement. And of course, there's also a body of evidence that shows that tailoring messages can produce positive results in different types of populations in terms of attitudes, intentions, and uptake. So finally, there's also well-established findings that healthcare providers are trusted messengers that can improve in some settings intentions and uptake. We found that high quality presumptive communication and persistent strategies were important for this type of communication. And for other messengers such as teachers and experts. So in summary, the variations in design, intervention quality prevented kind of very strong conclusions that we could draw broadly across settings, although some of these individual studies did provide some interesting insights. Really, new studies are needed to rigorously evaluate the impact of combinations of appeal, approach, messenger strategies on uptake. Specifically, we need appropriately designed and implemented randomized controlled trials. We need to focus on measuring actual vaccine uptake rates instead of only knowledge and intentions. And we need to consider both in-person and online interventions and settings and try to understand their interlinkages. So we use these results to develop simple visual messages in an online setting to encourage COVID vaccination. We developed 6 messages for 3 key types of vaccine appeals: disease effects, social norms, economic benefits. And then we paired one of these different appeals with a different type of messenger, either a healthcare provider or peer friend. This study is ongoing. This is an online survey that we're now administering through Amazon's MTurk crowdsourcing platform. We're doing this in a number of different countries. And the aim is to summarize vaccine attitudes related to COVID-19 vaccination, and then understand the outcomes of interest for each ad and explore the relationship with participant characteristics.
What we have in Ukraine is one of the highest level of hesitancy in Europe. Vaccine hesitancy. We also have some of the lowest vaccination rates in Europe. So we're dealing with a really challenging context that had problems with vaccine hesitancy way before the national vaccination campaign for COVID started. What we have as well is low trust to the healthcare system and official messengers. And this is what we're struggling with a lot. People simply wouldn't trust Ministry of Health and the healthcare system in general, and sometimes the government. Ukraine, as you may know, is not just the recipient of misinformation as the many other countries, but we are also, unfortunately, one of the countries who are exporting misinformation. We already have a multi-stakeholder demand generation effort. So whatever we do, we try to put in the context, and even international research studies such as this one, we're trying to put in the context of what is being done already to make sure that it's complementary and it actually helps the overall demand generation. What we did, which is the most important part probably, is that first of all, we had a very rigorous context analysis. It was a 3-month-long endeavor, and also with the help of Facebook and with the help of our local resources, we analyzed all the behavioral patterns and barriers colleagues from Yale needed to know to then develop the messaging. We then, based on that, developed 4 different digital campaigns that were linked in topic. It was COVID-19 vaccination. They were linked in design, but they all were based on different behavioral approaches. And then we ran brand lift study, with each campaign reaching around 7 million people. Now we're at a stage when we subsequently run a quantitative survey, also via Facebook, to learn more about the outcomes of our campaigns. And based on the survey and the previous results, we're adapting the same campaigns over again. And we will be running them again, but the improved versions that take into account all the insights we learned before. So Brand Lift Study is a tool provided by Facebook and some other platforms. And what it allows to do is to basically run different messages and different ads in test group versus control group. So first we start with randomizing the groups, and Facebook does it for you automatically. They help you set it up, and you have a test group which is receiving ads and a controlled group which is not receiving ads. And then the test groups can be also multiple. So in our case, we had 4 different test groups. So each test group was receiving an individual set of messages. And then we had 5th group who were not receiving anything. After they received the messages or the campaigns in their Facebook or Instagram feed, we wait for a couple of days, and then all 5 groups receive questions that are embedded in their feed. And those are the questions that you then use to measure the outcome of the ads that you use. And you can analyze which campaign had what effect. The first campaign that we developed, it was very simple in its design, and the main idea of the campaign was to deliver practical information. Even though we've been already half a year into the vaccination campaign, we still could see that there are people who are not aware that the vaccination is happening. So we just had a simple message. If you're a healthcare worker, time to get vaccinated against COVID, please do it. Here's the website. And interestingly, this is the campaign that was most memorable. So sometimes the most obvious and simple thing is the one that people remember. And also this approach gave the highest result in terms of switching people's intention to recommend vaccination to friends and relatives. The next campaign was about safety and efficacy, also a behavioral approach. And here we just gave people specific facts about why they should believe that vaccines are safe and effective. For example, we mentioned that already 2 million Ukrainians received the vaccination. It is safe here. We also mentioned, for example, that they're all pre-qualified by WHO, that international experts are testing them. And this safety and efficacy campaign was most effective in shifting perceptions of older people, somebody over 35. So our main insight from this was that when you give people practical, rational information about safety and efficacy, they don't just trust the topic more, but they also trust you more as a messenger. And also this campaign delivered the highest lift in agreeing that vaccination is important in preventing the spread of COVID. Third campaign was about liberty. It was about choice. We basically framed vaccination as a choice, but not just to choose to get vaccinated, but positioning it as something broader. Choose knowledge, choose family, choose health. And this campaign resonated most with the males from 18 to 24 and from 45 to 54. So what's also great about brand lists and what makes the study more in depth is that you have the disaggregation by gender and by age. And sometimes you can find the correlations that you can then work with in the future campaigns. This campaign was also highly effective in shifting risk-benefit perception. The final campaign, it's about social responsibility. So we try to motivate younger people to get their parents and grandparents to get vaccinated and to activate them as messengers and as community leaders who would then motivate older adults. Naturally, this particular campaign had the highest impact in terms of persuading people to recommend vaccination to their friends and family. What's also interesting, this is the behavioral approach that was most successful in shifting and in strengthening the perception of social norms. So these are 4 campaigns. As you can see, the visuals are quite simple. It's not a creative campaign. It doesn't have anything complicated in terms of design or production, but it was very thought through in terms of behavioral messaging, thanks to our colleagues from Yale. So we had 100 million impressions. So 13 million users reached per campaign. It's for Ukraine with the total number of 35 million people. It's a great result. And the next result was the positive shift in attitudes. And with the reach like this, it's not only hypothetical and it's not only for the research purposes, it's actually real people receiving those ads and real people saying that, yes, now we're more likely to recommend vaccination to our friends and family, for example. And finally, the final result is the click-through rate, which was extremely high. We had 320,000 people clicking on the official government's website where you can find your nearest vaccination point. This is actually the highest traffic that a website has ever seen.